Why are patients still waiting for weeks for mental health care when solutions already exist? Listen up for today's episode with Dr. Tom Milam, exploring how telepsychology is able to improve access, reduce wait time, and integrating behavioral health in everyday care. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. All right, we have Dr. Tom Milam here with us today. He is the Chief Medical Officer at Iris Telehealth and is an Associate Professor of Psychiatry at Virginia Tech School of Medicine and Research Institute in Virginia as well. Over 25 years of experience as a psychiatrist, and nearly half of which has been spent helping clinics and healthcare organizations to develop telebehavioral health strategies to improve access to mental health and also substance use disorder treatments for people who need it the most. So we're so excited to be in this space. And as me and Dr. Tom was talking right before we start going live, is that we see the big trend is really people start understanding the importance of behavior psychiatry. And we've been using telepsych even before the pandemic has been existing, and now it's become a lot more aware and leverage. And now we're thinking about how do you integrate access into primary care to get to it, and not just the typical base of ER. And it's a lot of changing, a lot of creating the advancements in healthcare, but also we're thinking about what does that mean to really balance you as a leader, you as an organizational entity, and also you as an individual who are still just a human, right? And then we still have our own drive, our own goal as part of the larger organization that we have. So we're so excited for you to be here. Tell us a little bit more about how did you got so excited into psychiatry from all the specialties that could be out there, and then now really spending a lot of your time with the telepsych space.
Sure. Yeah, thank you, Sabrina. It's good to be with you today. Psychiatry is a wonderful field. Sometimes I have colleagues say, how can you be a psychiatrist? And I'll say, how can you not be one? It's such an amazing and wonderful field because you're invited into very personal and sacred spaces in people's lives where they're struggling with their sense of self or relationships or just, as you said, being a human these days is challenging for many people. And so it's a wonderful role to be in, the psychiatrists and others who are in the behavioral health field, to help people navigate the journey of being human, being a spouse or partner, being a parent, being a friend, these areas where we all struggle to some degree. I'm known to say we all have our stuff. It's just some have a little bit more than others, some it's more intense than others. We all have some of this together, and the more that we can share and be open about things, I think the better. And so I have loved being a psychiatrist and teaching and being involved in the field. Telehealth came in, I moved from North Carolina back here to Virginia Tech, to be on faculty here at the Med School Research Institute. I was still caring for a group of about 15 children that lived in a residential treatment center. And we have 4 kids, and my wife moved here with the kids. I went back every weekend, 6 hours each way, to see those children because I couldn't find anybody else to take over. And finally we said, well, once a month, let's try doing telehealth. This was back in 2009, 2010. So let's try telehealth. Let's just see. And that's when I first experienced how wonderful it was, because I didn't have to commute every weekend. I did it 3 weekends and then every other weekend. And eventually was able to see the children and speak to the nursing staff and the coordinators, the parents, all through telehealth. And I was like, wow, this is really wonderful to be able to leverage this technology to bring together families and guardians with the children and staff, with me, and get great care where it's needed most. And that is really what's propelled me into leveraging just high quality care, but then leveraging the technology that telemedicine has afforded. Iris Telehealth was founded in 2013 by Dr. Tariq Shaheen, a fantastic child psychiatrist. So we were busy doing telehealth and telebehavioral health well before the pandemic. And during the pandemic, the early days, it was really wonderful to get the opportunity to help a lot of organizations learn how to implement telehealth so that people could continue to get the treatment that they needed. It's life-saving treatment for so many people with mental health issues or addiction issues. So it's still meaningful. And while telehealth seems different, it's still just leveraging a technology in order to get care where it's needed most. And we found that the patients, among others, really seem to enjoy it, the convenience and the flexibility that it has. So, it's fun to be in the field.
Yeah, it really goes both ways about the flexibility. If you think about your own story of spending 6 hours, and that 6 hours, you could have seen many, many children or patients. And when we are being prepped with the assistants, nurses to get them prepped, get on the video, and be able to still have that interaction of seeing the body language, seeing how they are, and then, just simply expansion, right? And that's the power of leveraging technology. So where are you guys are supporting mostly? Is that more of a B2B model or B2C model where you are connecting with the other entity organizations, or you still have your subset of a B2C virtual clinics that you guys engage on?
Yeah, that's a great question, Sabrina, because I think there are lots of different models out there. Iris had some core principles when we were founded. One is that we use our partners' EMR and video platforms. So we don't sell any software, hardware products like that you have to buy in order to get access to working with our clinicians. We have psychiatrists, psychiatric nurse practitioners, and therapists. And so while that has been a great decision, it's also been limiting in some ways in terms of collecting data on the work that you do. But really it came from what's the best way for us as an organization to leverage what we do. So we don't do direct to consumer like some other areas do. Partly is it's really related to our mission to help those who are struggling the most underserved. So a lot of folks with Medicaid or some places that don't have Medicaid expansion, we try to help with folks without insurance. That's a huge portion of the folks that we work with, or folks that really need it most and have the least opportunity to access care. So that sense of the importance of having this available to anyone that needs it and not just people with good insurance or something is key. So we work with community mental health centers, we work with FQHCs and rural health clinics. We also are just partnering with a lot of large health systems. So we see patients coming into the emergency room who might wait for days and days to see a mental health professional, psychiatrist, and we can see them in about an hour. What a huge transition that is from the way it used to be. Can you imagine going in and not having to wait hours, or in some cases days, or if you're a child going to the emergency room for mental health and you're having significant problems, it can be weeks. And we will see children again and again until they're getting better. So I think a lot of these systems that have that, where we're seeing them in the hospital or they're admitted to a medical floor, an ICU or something, we can use video to log in there. Our providers are working from a secure environment in their homes, but they can log in and see patients wherever they are. And it was wonderful before COVID. I think the flexibilities that came from CMS and from the DEA really have been good for patients, good for telehealth. And COVID really exposed how much patients need to be in the driver's seat about their care. And they need to have an opportunity to connect to providers that can really help them in the ways they need it, whether it's physical health or mental health. And so telehealth is really a big component of that. So really, it's fun doing the work and working with providers that are committed to this mission. but it's really fun working with patients and families and the gratitude that they feel because they have access to care, behavioral health care that they didn't have before. And that's very meaningful.
Right. It's a combination of different aspects. And I even remember when I was in training, the privilege of me in the psychiatric hospital that has inpatient side, that has the emergency side, and then the pediatric wing, right? So you're able to see that. And then we're on call. So yes, we're responding versus when we rotate out to the community hospital, the ER, you're just like, okay, kind, go do the psych evaluation, but we still have to wait for our mental health support to get there and then be able to leverage telemedicine and be able to, as you're saying, they are not just about our patients, it's about their caregivers, it's about all the other support system that's in place for these people. So if I give you a magic wand that can grant you 3 wishes for anything out there, right? What would you use it for?
Anything in healthcare? Yeah, it's an interesting question. I wish that everyone had access to high quality behavioral health care. I really think it's something that everyone should have because as humans, we need physical health care and we need behavioral health care. And I often feel that the behavioral health aspect of people's lives is something that's hidden sometimes in one's own heart and soul. In a family, people don't talk about things. And as a society, it's kind of hush hush. You don't talk about that. Don't talk about sex. Don't talk about psych stuff. Don't talk about politics. But the veil has come off, and people are opening up and sharing their journeys and seeing this as another aspect of who they are. Physical health, mental health, addiction stuff. It's okay. It's okay to reach out for help. So I would wish that everyone knew that that is okay. We all have our stuff, and that it's okay to say, hey, I'm struggling with this. It's depression or anxiety or ADHD or addiction, whatever it is. And I also wish that everyone had then the access to get care that's meaningful to them and culturally appropriate and sensitive in languages that people can understand with providers they can trust. There's a lot of room for improvement in that area. I hope that AI and technology too can be a component of that. Translation services that aren't so cumbersome. The ability to be more efficient, as you know, as a provider, having to write notes and do all that stuff. If you can leverage AI to help with components of healthcare that take a lot of time, that would be wonderful. And really helping develop algorithms that blend human knowledge with generated data knowledge and data sets and analytics so we can work compatibly together. So those are the things that I really wish for in healthcare. It's exciting to be in this field because it's always about caring for humans, whatever age, and humans are just just intensely interesting, I believe.
Yeah, because it's a complex, right? When my background is also in neuroscience before it got into when I decided, hey, surgery is something that I really wanted to do, and then end up going to cardiac surgery versus when I came out, it was like, do I want to go to neurosurgery or cardiac? Still want to do hearts. And then, but at the same time, right, we always have the heart and brain debate is what's important. Well, everything is important no matter what, right? It's a human being. It's a complete picture of who we are. And therefore, decision-making is challenging. Influence is challenging. Understand even just how we talk to ourselves is challenging. So be in this critical point where we are more open-minded now than I would say ever before. And with the emergent technology, and as you mentioned it, AI, right? Like there are many different apps now start coming out with how do we even figuring out proactively, are we having more negative thoughts than positive? Are we actively training our brains to be more engaging in different ways, right? And stay more motivated. There's all different things that's being exciting for us to in this field right now. And with the backup of having psychiatrists, therapists, and different component of nurses and everyone to put in the right effort as we go together. And one thing we did definitely say is it is complex, right? And building a business is complex. Engaging with people is complex. And actually figuring out how do we advocate the patient and then for them to actually take our words and do something, right? Because they can meet with us all day long, but if they're not implementing, it's also challenging. So we always like to think that our community is that supportive community. And as we are a platform for leaders in the space, we also love to support each other. So if you're imagine that we're a very comprehensive board of advisors for you guys and that we are celebrating your success as well as cheering on as you guys have grown to the next phase, what would be one question you would like to ask everyone to support you on at this point that really can help you guys to push Iris Health to the next level?
No, I appreciate you saying that. We spend a lot of time in business talking to chief medical officers and CEOs and CFOs and leaders, and that's wonderful. They bring a lot of experience and wealth and knowledge that in growing businesses and particularly healthcare related businesses. You're right, it's very challenging. I think one of the things that's important for us that I would ask everybody about is what's the patient journey aspect with behavioral health that's not being addressed? I hear from people calling me, friends calling me, hey, can you get me in with somebody? It's like, it is just so hard to get in with anybody in behavioral health. I think what drives things for us is the patient journey. And so I would love if people shared some instances of their patient journey, their experience with themselves or a child or a family member that was struggling with behavioral health. What were the problems that they faced? Maybe they still face those problems, those access problems. What would be helpful? What do you wish a company like Iris Telehealth, who gets these incredible providers that love what they do, they're compassionate, they're thoughtful, what would be helpful to connect them to the people that need it most? What's the best way to do that? Is it through like an app? Is it through some connected portal? Does it always have to go through insurance or not through insurance? What do people prefer? Because we mostly work with a lot of people with Medicaid or Medicare. So a lot of them have private insurance. But what are the barriers people are still facing? I want to hear from this advisory panel on what are the barriers so that we at Iris can know that we're addressing what's most meaningful to patients to break down those barriers and get care. And so I think it's, behavioral health, while there's chronic mental health issues, there's acute mental health issues. And we find that that's a challenge for people. And we get that in this country, you go to the emergency room when you have acute issues. But that is not always the best place to address behavioral health issues. So I'd love to hear about other options or thoughts or workflows or things that people are doing so that we can learn from them collaboratively and continue to support patients in their journey with behavioral health and addiction issues.
Yes. So for anybody who's being already involved in this field, or this is part of that channel of patient engagement that you guys are working on, it's really a great way of both market research and figuring out what is the gap in your own system so you can talk to other people who are already involved in the field, like Dr. Tom and his Iris Telehealth, to be able to figure out the right strategy. And then a lot of resources out there. We just actually needed to put our heads together, find the right people to have this engagement, the right conversation for us to all move forward. So we appreciate everyone. And thanks, Dr. Tom, for being here. And then we'll definitely share all you guys as a link for people to be able to connect with you and the group. And we can't wait for all the other amazing things you're going to do coming up. Yeah. Until next time.
Thank you, Sabrina. It's a pleasure being with you. Thank you.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.